Another edition of Ask NP Deidre. It's American Heart Month, and nurse practitioner Deidre, if you've been following along, you know that she had a heart attack a long time ago, and she has taken steps to prevent a second one, but also she's even taking more steps to help other people from suffering that same fate. And so she has her own practice. It's Aspire Wellness Integrative Health. And we're going to hear all the steps that she's taking to prevent a second heart attack, but also how she's helping so many other people. But I want to start with NP Deidre, very emotional day actually for both of us. But in your practice, gosh, it's just you end up with people that aren't getting help a lot of times in the mainstream healthcare system and are looking for not a band-aid, but they want to get to the source of what's causing all of the problems that they're facing, right?
Yeah, that I see that every day. Like we see people who've come, maybe seen every specialist out there. And then our traditional model, we get siloed, if you're a cardiologist, you only know about the heart. If you're endocrine, you only know about the endocrine system, and so on and so forth. And so none of none of that connects the whole person. And so when people present to us, they're looking for somebody to connect the whole person and kind of help understand how one system can be interconnected to the other.
Yeah, and we have Gary the holiest. I love Gary shows up at all of our YouTube. We have to invite him to info@padhelp.org and get him on our email lists, our calendar invites, so he can join our in-studio audience. But we love you on there, Gary, and you can just write in comments. And we have our amazing producer Joshua, who's right there for you and anyone else who has questions for NP Deidre about her experience, about your experience. Just go ahead and write them there in comments, and Joshua will grab them for us and get our intention, and we'll get them to NP Deidre to have her help you out and get some answers. We don't give medical advice, just information and helpful questions for you to bring to your healthcare team, and maybe even some resources to help you get some answers additionally. But NP Deidre, you had a couple of cases, today that really kind of hit home for you.
Yeah, I did. I mean, one woman was near the age when I had had my open heart because that was like I was
Oh
46.
no.
Yeah, and so she was 47 and had a stroke. And when I just listened to the story of like her journey of this healthcare thing, um, you know, and all the labs are coming back saying, hey, this is normal, but you don't feel normal, right? You don't feel normal when you've had such a traumatic event. And so that's kind of what we work on with patients, but it's so emotional. And so I've really learned to be very connected with my patients. And sometimes, like, I have cried twice today because of it. It's just been so emotional. So.
Yeah, but it speaks volumes to who you are and what you do. And that connection is so powerful. And you were mentioning that a lot of it has really, there's one commonality, and it's in the gut, the gut, the gut. And it's something that you drive home over and over again. And people need to understand the gut heart connection.
Right. So gut and all chronic conditions, there is a component of that. Like there's so many studies since, you know, 2002 that come out about the microbiome and various things, but there's that connection with metabolic and, inflammation and all of that. So if we're not like improving gut health, then we have a harder time staying on top of the medication, like chronic conditions, and we're just giving medications. I guess I often think it's like we're giving the band-aid, but we still don't know why it's happening. And so that's kind of where we come in looking at the microbiome and like, why do you have inflammation? How can we improve that? And so for this person, it was not just inflammation in the gut, but it was immune response. And so there were so many caveats to that her labs, like by traditional standards, look great. She had a great ApoB. She had, a low lipoprotein A. Her cholesterol levels are good. She's like all of that looks good. But then here's this person that just doesn't feel well. And so how do we like chisel that away and dive deep and work on things. So
And we have Karen who's watching on Facebook, and she says, will there be a replay of this? Because this is my story. So she's already resonating with this. And so it'd be helpful to learn, since you are talking about the gut. What did you learn about your gut health following your heart attack? And you joined the Zipper Club, right? You had open bypass.
yeah, I
You
did
did.
join the Zipper
And
Club.
you did. And when you decided that, you know what, I am going to take matters into my own hands and I want to actually improve my metabolic health, what did you find that seemed to be off to you that you thought, gosh, I wish I would have done this sooner? And now I am doing this for my patients to prevent them from having a major event as I did.
So I think gut testing is as important as looking at your cholesterol, and I do it every like 18 months. I do it very often because your microbiome changes and everything. But some of the things that I seen, like personally, was having low short chain fatty acids. So when you have low short chain fatty acids, you do not feed the body's own GLP-1 system. So that's where like metabolic stuff comes in. And then when you have a mucosal lining that is like depleted, which I did, low Akkermansia, Faecalibacterium. So that's a leaky gut picture that people talk about. And so you have to improve those things so that you can metabolically improve things as well. So, and then I did get COVID after my open heart, and then I tested after that, and I was like, my gut did not feel right for like months, and I was like, okay, what's going on now? And then I make some tweaks there. I've been lucky not to have inflammation in my gut, so that hasn't been a piece of it, but there's definitely like the digestive piece, not being able to break down fats and things like that. So supporting all of those things, because if you're not like if your elastase is low and you're not breaking down your food, you're not absorbing like the nutrients that you're getting through your food, or even if you're supplementing. And so that's something that, had to work on. And then I went a step further, even past the gut, because when I went out to that longevity summit, and I learned a lot about toxins and cardiovascular. And that's the first time that that had ever been introduced to me, that like your toxic exposure has so much to do with cardiovascular as well. And I was like, why have I never heard this? And so, and I'd already been doing like toxin tests on people who had exposures and was ill, but I'd never thought of it in the cardiovascular realm. So that's something that I, did this year and looked at my, toxin exposure, and I was like, okay, I've got to like start to detox this and work on my, getting rid of these toxins, because there was a cardiologist out there. I can't remember his name, and I can get that to you, but he showed imaging of like before and after removing of toxins. So he showed the imaging, he showed the total tox test, and he even showed the labs. And you can see an improvement cardiovascular wise when you're removing toxins. And he had been doing it. I really think it's like 20 years before it was ever a popular thing, and had so much knowledge. But it's not something that we hear in mainstream at all, to talk about that.
Yeah. I think that's so important. But in terms of the second patient that came in today, the one that had the stroke, um,
Yes.
when you're guiding her, and you're saying, hey, here's all the things that I did, how do you make it make sense for her? Because it does seem a little overwhelming. And I'm sure people are watching going, oh my God, I'm going to be feverishly taking notes here. Oh my gosh, how do I get my doctors to do all these different things? How do I know which one I need or which ones I need? And how expensive is it going to be to do that?
It's true, because when you're looking at functional and integrative medicine, a lot of times insurance doesn't pay for it. And so there is that out-of-pocket fee that happens. But I would definitely look for a practitioner that has been doing this a while, especially the gut testing and everything, and can speak on like these cardiovascular issues that many of our patients are having. So, your traditional doc could probably do a calprotectin and a fecal lactoferrin, which that's a stool test that LabCorp can run through and know if there's inflammation. But beyond that, it's the like, what do you do with that information? And so I actually use a lot of supplementing food as medicine, and working on your stress. If you don't work on your stress, your microbiome's going to be off, and that's a huge thing. And sometimes we don't recognize stress for what it is, right? If you would have asked me 6 years ago before my open heart, I would have told you I wasn't stressed. And I had to like peel those layers off to realize like it didn't matter what I said in my head. It mattered how my body was perceiving what I was going through. And so that was a hard one for me to swallow to recognize that I was having stress.
Yeah. I always wonder, I mean, it's not always reflective right away. A lot of people, their bodies absorb it in very different ways. And that's almost what's kind of scary is that it does get absorbed right into your arteries and it causes inflammation throughout your body. Some people measure their stress by just if their blood pressure goes up. But I know I've been stressed and my blood pressure maintains, it stays the same. So
Mhm.
it makes me wonder, am I absorbing that stress somewhere else? Not only in the arteries, but also in the gut and maybe causing inflammation there, which becomes a grander systemic issue.
Yeah, it really does. One thing I think in this like cardiovascular realm that we fall short on is actually like diving into people's adverse childhood events, because I can tell you when I see early young people who have these chronic conditions, like you have to be thinking what happened in childhood to set this inflammatory response so early for them. And so I think that's a piece that could be added into questionnaires and understanding that, because the higher that score is, the more inflammation that's there. I don't know if you've ever read that book, The Deepest Well, and it's a doc who like she works for Kaiser Permanente, and so the stories are great. You'll cry, but it really talks about how adverse childhood events starts an inflammatory kind of cascade that can be 20 years and nobody catches. So if you're 4 and your parents are divorced or there's something going on traumatic and we've never learned how to internally deal with that or like break that apart, we've just kind of suppressed it, then that inflammation is there. And maybe you think, oh, well, my friend went through this too, but we all perceive that differently. And so that's a piece to things that I have learned is a very important piece to people in their healing journey is like understanding like when did things first start for you? Because and kind of breaking that apart.
Yeah, and when you dig deeper, I think you shared a story about that. It was it. Gosh, I can't remember if it was last week or several weeks ago. You opened up about a patient that brought you way back, or was that was with your coach? We had that conversation,
Yeah.
and maybe she was the one that ended up digging and digging and digging, and it was like, whoa, what did we just unravel here? What did we
Yeah.
find? And that became the source, something that happened when she was younger that she didn't realize was really something that was still impacting her emotionally and
Right.
ultimately physically.
Mhm. Exactly. And so I think when we have patients that have such chronic diagnoses, and especially the young patients, and when it like if you're 40s and having a heart attack or stroke, like that's not normal. So what is happening, because that heart attack that happened in your 40s started in your 20s, it wasn't something that, I mean, I guess sometimes there could be something that caused it acutely, but for the most part, it's some sort of chronic thing that's happened.
The one thing I know I shouldn't say this, but I don't care. That doctors will say, well, you have this, it must be just hereditary. And they don't do additional exploration to see, well, why is it hereditary? So maybe when this one patient that I talked to earlier today, when her parents were died of a heart attack, both in their 60s, many, many moons ago, maybe they had undiagnosed clotting disorders. Maybe there was something more that maybe Now the daughter's having problems. Maybe it's a clotting disorder that's causing it. Why not send her to a hematologist versus just saying must be hereditary and leaving it at that versus doing the advanced exploration, which I think every patient deserves. I think every case warrants that.
I do too. I agree with that. You know, they have that saying, genetics loads the gun, but lifestyle pulls the trigger. So you can have this genetic piece of things. And, you know, I wanted to know more about myself. Like, do I have these genes? And I knew on one side of my family I did because I had a mother who died at 57 with a stroke. I had an aunt with a 5 artery bypass at 50. I had a sister with, a heart attack and a pacemaker at 40, and I had a grandfather who passed open heart at 52, all on the same side of the family. And I was like, why is this happening? And so I knew one side of my family had these genetic markers. And so I had done the advanced genetic stuff for my heart. And I was like, both sides, I'm seeing it both sides. And so then we think of like lifestyle. Well, what would have pulled that trigger for me to have this early diagnosis myself? And so was it stress? Was it the environment we live in, the toxins? Was it, you know, the foods that we eat? There's so many pieces to that that we have to break apart and figure out like individually what is affecting us. And so that's what I've done for myself is just break it apart. And it doesn't happen in the first, didn't happen the year one. It was like a little bit I learned about myself, a little bit more, a little bit more. And like, I feel like for several years, I felt really great. Like I don't even feel like I ever had a heart attack except it plays in my head. So yeah, I don't feel like I had an open heart there. You know, I've had to work through all of that too. So I think having those people on your side to help you work through that, you know, medical trauma that happens.
Yeah, I think people underestimate just the mental impact. And I always tell, patients that come to us, I always say, you know what, honestly, I would get a psychological eval. You're not crazy, that you don't need medications. You just need sometimes someone to talk to and help you think through things and talk through things that sometimes your family may not understand. There's a lot of times, when you're talking to your family about things, they have their own self-defense mechanisms, right? Where if they can't control your illness, if they can't control your fate, they might react in ways that you wouldn't expect. They might push away, they might say things that irk you or are a little bit more curt versus understanding and empathetic. And or they might be overly attentive, which then makes you feel overwhelmed and smothered. And then you start defining yourself by the disease because everyone else is. And it's just this vicious cycle, right? That could go any direction. So just go talk to someone independent that has the training, a counselor or a psychologist that can just work with you to sort through things until you feel like you're ready to strike out on your own, right?
Yeah, I think that's an important piece to things because when you've had something traumatic, and I just think of my open heart, and I think about like before I was rolled into the OR and everything, and I was looking at the numbers on the room, you know, as I was going down the hall, and all I could think is this may be the last thing I see because my grandfather didn't live through his open heart surgery. And so you play into your mind of that, like you feel so alone, you feel like you know you're just out here doing it yourself, and then you survive it, but then you're like, why did I get this second chance? Like if there's other people that don't, like what is my purpose then? And like finding that, and so you're left with all these emotions like I almost lost my life, this piece of me is there, but yet like what is my purpose to move on, and you know how can I give back to this world? That's kind of what played in my head. And then I think of the medical trauma because for 2 years prior to that, I was just feeling so bad. And I like would talk about the signs and everything I was having, but I just didn't have anybody to listen to me, not even my practitioners. And so now thinking about that, like, well, I like didn't have anybody that was listening to me. And so you have to process all of that. Like what does that mean? And then I read the studies, knowing too much is not ever good, because then I read the studies of like my longevity after something like that. And then my head got stuck in this, I'm living my life backwards. So now I have 19 years and 3 days and I have 19 years and two. Like it just, I did that for a while and I realized like can't let myself get stuck in my own headspace. So I really started focusing on like, I have to put the work in to get myself out of that headspace. And that's a piece to healing that I think really needs to happen. So don't feel like being vulnerable and going to a counseling is ever wrong, because it's not. Um, and I did like I got the Calm app. I couldn't go anywhere. I was like doing meditation every day. I was like journaling out. And then I just knew in my mindset, I have this spiritual belief as well. And so that helped me through this. But in my mindset, I was like, I have to see myself well or I'm not going to get there. And every day I got dressed, even if I didn't feel it, even if it was 2 o'clock before I could get out of bed, I would still get dressed like I was going to work. Like from the day 6 after open heart, when I got home from the hospital, I would get dressed every single day. And I was like, if I don't, my mental health says I'm just going to lay in this bed and I'm going to focus on what I don't feel like well. And so I think like being in your own head and like learning to like see yourself well. That's a big piece to healing too. Because we don't get well if we don't see ourselves well. If we only see ourselves aching all the time, well, then that's what our body focuses on.
I think that's such an important point. It's easier said than done, right? Um, because you say to yourself, well, how do I see myself well when I am aching, when I do have pain, and when this? But it really is a game that you have to make a choice. It's a strategic choice
Mhm.
because your mind's not going to make it up for you, right?
No.
You get into habits of thinking. So you're going to have to stand up and say, hey, I'm going to take control of my life. I am going to make a strategic choice. Even if I don't feel it, I am going to at least start trying. And I'm going to say, I want to see myself well. What does being well feel like? Can I do something right now that I would do if I was feeling well? And there are still things. I would get dressed in the morning. I would walk outside to see the sunshine and watch the birds, like if I was well. But even if you're not well in that moment, why couldn't you take action as if you were well,
Mhm.
right? To start promoting it is the thinking. Am I making sense?
No, that is the thinking, because I can only speak to my story, but I still have a lot of patients when they come in and they're not feeling well and they've been through this traumatic event and surgery and just everything. I really try to get them focused on what does it look like when you are well? Not if you're well. When you are well, what does that version of you look like, Kim? And I have them speak it because like they have to see it. So for me, one thing that I thought about is, I love to be outdoors. I love to hike. And we've talked about like how I accomplished that after open heart. But I literally every day saw myself at the top of a mountain with my arms out. And I would like focus on that, focus on what that felt like. What was the air going to feel like? What was my heart going to be pumping and doing? Was I going to feel the blood rushing through my whole body? Was my legs going to be aching and fatigued and like everything about that? What did the color of the sky look like? I literally thought about it every single day. And then I started like doing little hikes, little walk around the neighborhood. That was during COVID. So my daughter got what is that app that you walk around and try to, um, I don't know, it's a cartoon that you're picking up things that aren't really there.
Oh,
I can't even think of what it is.
shoot, I know our producer Josh knows what it is. Or maybe Heinz, who's also here in our live studio audience, might know what it is.
Pokemon Go.
Pokemon.
Yeah.
I was just, yes.
So that's what I did with her at first, because she was like, "We're gonna do this," and so I did that, and so I would be able to walk a little bit further. And then
Yeah.
I had a brother who he was really just amazing. He would come down, and we would start to just hike at the metro parks and stuff. And I was so short of breath with all those meds and everything, but he would like stop and let me catch my breath and everything. But like mentally, he was like, "You're going to do this. We're going to do this." And I almost gave up even on that climb to Mount LaClarent. We got halfway up and I said, "I think I'm going to turn around." And he was like, "You are not turning around. That's not what you've seen. That's not the vision you've seen." And like, so I had him pushing me and stuff. But yeah, it's just you have to see yourself well. That's what I would say. You have to see yourself doing something that you really want to do. And so for one of my patients recently, when I asked her about being well, she said, "I want to be able to play with my grandkids. I want to be able to get on the floor with them and not hurt." And I was like, "We can do that. That can happen." Yeah.
Yeah, what does it feel like to be on the floor with those grandkids? What do you
Yeah.
do? What do you move the little truck around, the little fire truck? Do you
Yeah.
tickle them in their belly? Do you hear them laugh and squeal? Like, what is it
Yeah.
that you enjoy so much about that moment with your grandchildren that gets you excited, that makes you feel so well?
Yeah. And I think that part of our mindset has to happen. Like you have to write it out, what it feels like, imagine it, like let yourself feel it in your mind so that you can get there.
And I think it's interesting because we have several people that feel as though they smoke, and smoking is a huge risk factor for both peripheral artery disease and heart disease, along with cancer. But they say that, wow, I'm really, really lonely, so that's why I pick up the cigarette. Well, you have to make a strategic choice, right? You need to see yourself in wellness. You need to see yourself not stressed, and you have to make the strategic choices as to what you can do to make yourself feel well, what you could do to make yourself not feel stressed. Go somewhere, do something, turn on the TV. If you were well and you weren't addicted, what would you be doing right now?
Mhm. And a lot of times that when you have a habit like that, like smoking, asking yourself, like, why am I picking this up? What's my emotion behind it? Even with food, what's my emotion behind it? Like when I'm eating not to fuel my body, when I'm doing something that's not truly fueling my body, asking myself, what's my emotion behind that? Because
Yes.
once we start to recognize the emotion behind it, it makes it easier to make the change to stop doing that.
Yeah. And so today, how do you view being in a state of wellness? What does wellness for you? How many years later post heart attack?
6 years. I'm
Six.
6 years past. Yeah.
How do you define wellness for you today?
So, well, wellness is waking up feeling good, feeling the breath in my air. I'm still able to hike. Have like an amazing practice. I have people that surround me that bring me joy, and that's a huge piece to it for me. And it's, you know, having that clarity of my purpose and what it is.
And healthy marshmallows for your gut.
Yeah. I heard you got the video, right? Did she send them?
No, oh, I
Oh,
didn't know. I did get it. I
she
wonder if it
made
went
them
to
for
spam.
you. She made
Are
them
you
for you.
serious? I'm so excited. For those of you, you have to go on our channels and subscribe to our channels and search our channels at NP Deidre. That's her YouTube channel. And then ours is at The Way to My Heart, both on YouTube. You've got to search for this video under, I think, the playlist for Ask NP Deidre, where one of her colleagues seriously makes the most incredible,
Yeah.
healthy marshmallows that are good for your gut.
Yeah, she does. But she even did what
It's
you
amazing.
asked, videoed it out and everything, and asked me for your number. So I gave it to her to send you everything.
This is just going to make my whole week. And I'm so putting something together on that because I've had many questions. Well, how do we make them? Someone's got to show us. And now we're going to have it. So
Yeah.
everyone's going to have a healthy gut with these marshmallows. I can't wait to just store them in the fridge and pop them in my coffee every day.
Yeah, that's what we do around here. She's always making them for us. It's really good. And I like the ones that she puts cinnamon in, so she's always doing those for me.
Nice. And Ceylon cinnamon, especially, is really, really good for helping with your A1C.
Yes, it is. Yep.
Awesome. Well, thank you so much, NP Deidre. We really appreciate you, giving us the update and helping us to understand what you're doing now as a nurse practitioner, as a functional medicine practitioner, for yourself and for your patients to not only prevent a second heart attack for you, but also prevent others from facing the same fate as you did with a major event. So thank you, thank you, thank you for continuing to be here and updating us.
You're welcome.
So make sure everyone like the video, subscribe to our channel. And if you want to be in the live studio, Gary the holiest, I'm talking to you. Go ahead and email us at info@padhelp.org and we will get you signed up with calendar invites to all of our major events. So NP Deidre is on every single week with a different topic. Not sure what we're doing in the next couple of weeks, but watch the channel. We'll send you notifications and have a great week, everybody.